The COVID-19 vaccine is now being administered to preteens and teenagers. How is this beneficial to the younger demographic? And what can we expect when it comes to side effects? Welcome to A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. I'm Nicola Barito. A Matter of Fact is designed to inform and educate you about the SARS-CoV-2 virus, which causes COVID-19. We also take an in-depth look at the benefits of vaccination. My guest is Professor Peter Figueroa, Chair of the Caribbean Immunization Technical Advisory Group. Professor Figueroa, thank you so much for joining us on A Matter of Fact. The COVID-19 vaccine, preteens, teenagers, how effective is this? What are the benefits?
The Pfizer vaccine, which is a messenger RNA vaccine, has now been given emergency use listing to be used in teenagers, those 12 to 16 years of age. It is now approved in adults over the age of 16. The big advantage that this gives us is that it means that we can get our teenage children vaccinated before they go back to school. And this is very important because we know young teenagers mix a lot. They can become infected with or without symptoms, and they can pass the coronavirus on to their family members, their parents, their grandparents, their neighbors, their friends. So others can be at risk, especially our elderly and those who are more vulnerable can be at risk from young teenagers. And then in rare instances, unfortunately, more frequently than before with the Delta variant, we are seeing some of our teenage children getting seriously ill. So this vaccine both will protect them from getting the disease and help to reduce transmission among them and between them and older adults who may be far more at risk of severe COVID.
What can parents expect when it comes to side effects? Is there anything major that we should look for?
Now, the Pfizer vaccine that we're using in the teenagers who we're going to be vaccinating, those 12 up and older, it is very effective and safe. So most persons will not have anything more than perhaps a mild headache, fever, tiredness, and possibly a little discomfort in the upper arm where they get the injection. And many persons will have no side effects whatsoever. They will hardly even notice that they got the vaccine. However, there are very rare adverse events. We're talking about adverse events 1 out of every million doses, where we have seen with the messenger RNA vaccines that you can get a very severe allergic reaction that we call anaphylaxis, where the system can collapse. But what is good is that I'm not aware of anyone or very few people dying from this because we always have adrenaline, antihistamine, steroids present at the point where you're being vaccinated and quick access to a medical practitioner. So in the very rare instance of a severe allergic reaction, then the person can be treated immediately. And we always observe for at least 15 minutes before the person is sent on their way. And if they have a history of severe allergic reactions, then they are observed for 30 minutes. Now, younger persons, maybe in 1 out of every 100,000 doses, may get a little inflammation of the heart, a myocarditis. But this is unusual, just 1 out of every 100,000 doses. It's self-limiting, no deaths, and persons usually recover quickly within a couple of days. It's just a little chest discomfort. And we now realize that it does happen a little more frequently in young men than young women. So the vaccine is safe and effective.
Thank you, Professor Figueroa. This has been A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. Get vaccinated.